Hello everyone, my name is Taru, presenting to you today on indicators of physical activity among children and youth in 9 countries with low to medium human development indices. These are the 9 countries that participated together with 40 others as part of the Global Matrix 3.0. Lifestyle transitions, that is, a decrease in physical activity and an increase in sedentary behaviors, have been reported among children and youth across the globe. These transitions have been implicated in the rise in childhood obesity and a higher risk of other non-communicable diseases in early adulthood. The World Health Organization projects that the fastest growth in urban population in the next few decades will occur in Africa and Asia, because most of the countries in these parts of the world, there's a lot of rural to urban migration due to industrialization and the unintended consequences of economic growth. So people are going to look for opportunity in cities. There's probably factories and job opportunities and such. Unfortunately, in these countries, we don't have a lot of data to inform accurate estimates on lifestyle behaviors. Results from the report cards for these 9 countries at least have demonstrated that there is really not enough information for us to be confident that we know the levels of movement behaviors among children and youth in these countries. So therefore, the objectives of this presentation are to compare and discuss report card grades from the 9 countries that I'll be talking about today. These countries are Bangladesh, Botswana, Ethiopia, Ghana, India, Nepal, Nigeria, South Africa, and Zimbabwe. As you can see, 6 of these countries are from sub-Saharan Africa, 3 are from Southern Asia. Second objective will be to discuss the common data gaps in the 9 countries, and the last objective will be to provide some future work, priorities at least for future work. This map just presents and at least gives you an orientation of where these countries are, on the world map. They are, of course, low and medium HDI. 6 are in sub-Saharan Africa, 3 are in Southern Asia. Here is a presentation of the socio-demographic information of the 9 countries listed in alphabetical order on the left, and then the common socio-demographic factors on the top. As you can see, the HDIs for these countries ranged from 0.448 in Ethiopia to 0.698 in Botswana, not very big variability. Gini indices ranged from 32.1 in Bangladesh to 63.4 in South Africa. By the way, the Gini coefficient, you want it to be lower. Lower means closer to equality. Higher means closer to inequality. In terms of urban population, 3 countries actually have populations above 50% of their total population. Highest in South Africa with 64.8, and Botswana and Ghana have at least 50+% of their populations in the urban centers. Botswana had the lowest population density, only 4 people per square kilometer, highest in Bangladesh with 1,252 people per square kilometer. Here, the presentation for the report card grades. So they are organized with the indicators on the left. So the 10 indicators are on the left. The countries are on the top, and on the far right are the overall, at least the mean grades for each of the indicators per country. Sorry, for that indicator for the 9 countries. As you can see, the countries did well on behavioral grades, at least a C+ on most of them, at least C- rather, and above. And however, they were lower on the sources of influence, mostly D's, 1 C- on the government. Interestingly, physical fitness was poorly graded. Only 1 country had a grade for physical fitness among the 9. Active transportation was the only indicator to be graded by all 9 countries. And Ethiopia was the only country with at least 1 missing grade, others at least 2 or more. Okay, so here to just show how we assess each indicator. So all of the 10 indicators would have used the same sort of format. So I present here for overall physical activity just to show what we did, how did we grade these indicators. So this table here shows that of the 9 countries, the total sample from these countries that informed the overall physical activity was about 56,000 people. 3 countries could not provide sample sizes for their samples. Only India and South Africa were at least able to provide some objective data for assessing physical activity. Most of the countries used subjective data. This figure here presents letter grades for each, so at least each letter grade, F to A. Incomplete is on the far left. As you can see, there were 29 incomplete grades, and it's a fairly normal distribution, with the letter grade C being the most reported. At least 26 grades were C's. We only had a few A's and a few F's. Here is sort of this similar concept, except now we are comparing behavioral grades versus sources of influence indicators and comparing how are they spread for the grades of these categories. As you can see, the incomplete grades are fairly evenly split, 10 and 11. And the behavioral indicators, at least they had higher grades, and sources of influence at lower grades, and that is shown in this figure. This figure presents a unique pattern of incomplete grades. So the 29 grades on the left is just showing by indicator how many grades were missed. So physical activity, there were a few indicators, and then the highest missing grade was physical fitness. And then on the right is the actual patterns. The indicators are listed from left to right, and then the patterns of missingness, as you go up. And so you can pretty much look at, the first row, and you can see that there's one country that was missing one grade, and that's of course Ethiopia, with only physical fitness. And I'm cheating because I know this data quite a bit. All right, so let's talk about this data. The grades were fairly narrow, like the spread of the grades were very similar, clustering, suggesting that we have comparable challenges and perhaps similar opportunities which we can collectively exploit. Active transportation was the only indicator to be graded by all 9 countries, perhaps suggesting the issue of choice versus utilitarian. Most of the kids in these countries have no choice, but they have to walk to school, to do chores, to accomplish tasks. However, these data are wobbly, mostly subjective. So can we believe them? How much can we believe them? Are they reliable? Those sort of questions are very important for us to ask. The other question to ask is, if we build it, will they come? We have seen that although we are doing poorly on sources of influence, our behavioral indicators, at least the grades, are higher. So don't we need infrastructure? Do we need infrastructure? How much of it influences the other? Question for discussion. Key messages. There's clear evidence that we need high quality data, representative data at a country and regional level. This will help us better understand the levels of physical activity among kids in the countries that I'm talking about today. Overall, the grades for behavioral indicators were higher, despite, of course, lower grades for sources of influence, suggesting perhaps that sources of influence are not the only driver to get higher grades for behavioral indicators. Perhaps there are other influences that we also need to interrogate. The lack of objective and overall low quality data is something we need to address, perhaps giving us an opportunity to collaborate, to develop strategies collectively, to be able to address the data gaps that are existing in our countries. The challenges and opportunities are much more similar. Maybe we should have a generic approach to solutions, not so much individual solutions. For the future, we really need to obtain reliable and representative data. This might help in our surveillance efforts, to be able to better understand and inform our strategies for physical activity among kids. We need to invest in strategies that can capitalize on the current craze that we have for behavioral indicators, sort of promote that as a way of life, make kids understand that walking, doing chores and all that is a good thing for their overall health. There is an opportunity for countries really within themselves or between themselves to try and collaborate to create common goals and try and find ways to reduce sedentary recreational time and promote physical activity among kids. Finally, this is the paper that we wrote as part of this effort. It's available open access in the Journal of Physical Activity and Health. You can go and get it for free anytime, anywhere. Just download it and read for yourself. I would like to thank the Active Health Kids Global Alliance for affording us this opportunity, and my co-authors on the manuscript, without whose help this paper would have been impossible. I would like to acknowledge the country report card leaders, their committees, working groups, and data custodians and collaborating partners for providing us with all these data and information that we have used to make this presentation. On a personal level, I would like to thank the Canadian Institutes of Health Research who support my doctoral studies. Thank you very much.